Hi, I'm going to be speaking to you today about the simulation debriefing for week 6. Now, there's 5 questions. The first one is share what you learned while completing this week's simulations. So, one of the main things that I really practiced a lot during this week 6 plan was writing goals. For the occupation based workbook 9 and 10, we had to see a YouTube video, and we basically had to write a whole kind of like the whole OT process for that client, Jason. So it really kind of made me think a little bit more on that type of spectrum, like thinking about what I see and what I could write down as far as the OT process, the evaluation, the intervention, and then the outcomes. So it asked a lot about like his strengths, his weaknesses, his psychosocial concerns, and also some goals that you would work with him on and a home program. So it kind of really made me dig a little bit deeper into whenever I see a patient to have that in the back of my mind as like a map for working with the patient. Second, what is important to understand? Why is it important to understand the different adult practice settings where occupational therapy can be found? So it's very important to learn what types of settings there are because it's a continuum of care. So, for example, when patients are going to be discharged from an inpatient setting, the two main areas would be either home health or outpatient. So you would have to know exactly what involves, like the occupational, what is involved in a home health setting, what the role is for the OT versus the outpatient. And from there, you could refer them as to what you think is best for him. So, for example, if they still needed maybe a little bit of help, let's just say they weren't as independent whenever they were discharging inpatient, and they still needed maybe some help with basic ADLs and IADLs, then you would probably discharge them home with home health services. Once you discharge them from inpatient straight to outpatient, it's not like they can go back and get home health. So knowing these things and knowing what the role is in the practice settings and what the role of the OT, it's very important because it's your decisions. Your reasonings and your skills are going to be what you refer the patient to what you think is best for them. Okay, third, if you had to choose, which adult practice setting do you prefer and why? I love inpatient. Inpatient is my favorite practice setting because it's the most intense setting there is for patients that are trying to recover. I prefer it because it's 3 hours of therapy and I feel like you see most results there. From the acute side, they're maybe stepping down from maybe like a ventilator or they're barely starting to move. So the therapy, although it is beneficial, it's still a little bit limited because maybe you have to adhere to their precautions, their vital signs. You have to monitor a lot of what's going on with them internally. So I feel like you're limited in that aspect. Whereas inpatient, since they have to tolerate 3 hours of therapy, you can do a lot more with them. Number 4, if you had to choose, which adult practice setting do you find to be the most challenging and why? Again, inpatient because of those reasons. The patients are moved much more in inpatient. So you're getting them from very acute to working with them now for 3 hours. Maybe their total assist when they come to you. So within those 2.5 to 3 weeks that at most that you have with that patient, it's a challenge because you have to get them to the most independent level that they can be, because the goal is to discharge home so they can in the future go out in the community and instead avoid going to skilled nursing facilities. So I feel like inpatient is harder in that aspect because you get them whenever they're low level, and within a short period of time, it's up to you to, and obviously the whole team, the whole care team, to try to get them to the highest level that they can be. 5. What are 3 evaluations/assessments that can be used by an occupational therapist within the acute, inpatient, and outpatient adult settings? Okay, so I have a list here with the acute settings. You can use FIMS, obviously, because you have to have FIMS in order, so whenever they discharge anywhere else, they kind of know how the patient's doing. So functional independence measures 1. They may have the pain scale. So that's another one that they use, as they're barely starting to move. So using that pain scale of rating from 1 to 10, how would you rate your pain? 10 being, very, very, very tough pain. So using that, and the anxiety and depression scale, just to see their psychosocial concerns of how they're feeling at that time. Inpatient, 3 evaluations or assessments that you can use. FIM is also one of them, the functional independence measure. Also, the Barthel Index to see how they're doing with their ADLs. The Fugl-Meyer assessment, especially if they have a stroke, to see how they're moving on the arm, if the arm has tone, spasticity, motor control. Dynamometer for grip strength, and the pinch gauge to see how strong their grip is, as far as like pinching tripod or even the pincer grasp. The mini mental state exam as well, just to see how alert and oriented they are. And for the last one, it asked for outpatient as well, I believe. Yes, outpatient. Okay. For the outpatient setting, it would be 9-hole peg test, the timed get up and go test as well, just to see their mobility, the aspect of their how they're moving around. Also, the functional reach exam, so you can determine how at risk they are for falls, and the same thing, kind of dynamometer, just working a little bit more on strengthening and getting them to that level of independence, or how they were maybe after a stroke, just to see how much their strength is for that involved side. So thank you so much.